Hi, I'm here with Dr. Lesley Russell, who's Adjunct Associate Professor at the Menzies Centre for Health Policy here in Sydney. And I've asked Lesley to come and have a chat to me today, actually to interrupt our very healthy walk around the Bay Precinct, to have a chat about the upcoming budget and perhaps any ideas for the health election. As you can see, we've got a very inspiring environment for this chat. I'll just pop up here into the wind to show you where we are. Does that give you... Yeah, we've got birds
and a parrot
singing
in the tree.
We may have a random dog joining us at some point. There are a few dog walkers around today. But do you find it inspiring, Lesley?
I do. I hope the budget is this inspiring. I'm not sure.
So we're only about 10 days out from the budget, is that right?
May 3rd.
May 3rd,
yes.
Yeah, okay. And you're quite famous in health circles.
Or infamous.
For producing these amazing budget analyses. How many will this be?
I think the first one was done in 2007,
okay.
and they get harder to do and bigger every year. But it's got to the stage where people now expect me to do this work, and it is one way of really understanding where we're headed.
Yeah. Okay. Well, we're all very grateful for it. Actually, I think my favourite one was back in 2014. Lesley doesn't pull any punches in her budget analyses, and really, you only had to read the headline: unfair and unhealthy. Never mind. But so hopefully you'll be able to give a better report this time. So actually, just in the lead up to the budget, Lesley, there have been a few announcements on health, haven't there?
There've just been a few. There was the COAG announcement around more funding money for hospitals, and linked to that was the announcement from the federal government about healthcare homes, which everyone has welcomed, but obviously there's still a lot of work to be done around exactly how that will go. Also linked to that, which we've not heard anything further about, were requirements that there would be an increased focus on quality and safety, and also on preventing hospital readmissions. We don't know how those are going to work, whether there are going to be carrots and sticks in place to make that happen. Of course, more recently, there was the announcement about changes in the public dental health program.
Yeah, you must have pricked up your ears at that one.
Look, I'm one of those people who's been writing for a long time about how important dental health is to total health. But I think, so I'm really pleased in one sense to see this, but I think in another sense I have to start looking a gift horse in the mouth. And it doesn't quite seem to add up at this point in time. Right. You know, I'll be a little bit patient, wait for a little more detail, but I think they are promising things that cannot possibly be delivered with the amount of resources that are available.
Do you think maybe we're looking at a long-term plan here?
Wouldn't that be great?
Yeah.
Wouldn't that be? I mean, you do have to start somewhere,
yeah.
And we shouldn't expect something totally fabulous to begin. And I do think that investments in prevention around kids' dental health early is probably the best spend.
Yeah.
I'm just a bit cynical. I'm sorry about that.
Yeah.
I think the other thing is we have to remember that this is a budget that's presaging an election that's obviously going to be pretty tough. One of the things we heard just in the last couple of days is that the Turnbull government will have quite a lot of money for infrastructure, and I'm willing to bet that a lot of that infrastructure will be doled out in marginal electorates come the election campaign. The money that Labor had initially put in the Rudd government period in the Health and Hospitals Fund for infrastructure has now all been spent. So I'm thinking that there'll be some replacements for that around hospitals, and perhaps even whatever the Liberal version of GP super clinics is. Again, it's hard not to object to that, but really, if money is in short supply for healthcare, are bricks and mortar what we really need? I think we need healthcare professionals in the right place, and a much better focus on prevention, and I'm really worried about where we're not headed in primary healthcare research.
So yeah, there's been some really some big announcements and non-announcements recently in that department. Do you hold out any hope that there might be some overarching plan in the budget that will address some of these holes that are going to be left when these important research initiatives cease?
I don't really. I mean, I think it's too late to resurrect AFCRI, at least in its previous form. So maybe we get something else.
Yeah.
But is there the willingness to do that sort of innovative work? I think the loss of PICRIS means that all the work that's been done can't be effectively communicated. And I just think that, 18 years of beach data, whatever is going to happen to that. I mean, the irony is that we could probably run, outside of the PICRID research funding, we could run AFCRI, PICRIS and Beach for probably not more than $5 million a year. So it's the smell of an oily rag. Yeah. I'm afraid that what they're going to say is that money will all fall out in the Medical Research Future Fund.
Yes.
And health services research always comes a very poor last when it comes up to fronting against biological cures for cancer.
Yes, and you have to feel for whoever's going to be in charge of allocating those funds too. They'll have to hit the ground running when existing research initiatives are being killed off before we see the fund even starting, I guess.
That's right. I mean, the fund is lacking a whole lot of money that was supposed to go into it anyway. And much was promised, and to this point virtually nothing has been delivered as far as the research fund was concerned.
Yes. So you think this budget is going to be an infrastructure budget and a bit of a budget that keeps on giving, so maybe it'll be the world's longest budget as well as the longest election campaign, you think?
Yes, well, I think what that means is that a lot of the things that are affiliated with the election campaign actually won't be in the budget.
Yeah.
So you'll have to look at those contingency funds,
yeah.
read the contingency funds. I mean, the increasingly as I've done these budget analysis, a lot of stuff is hidden, and you can hide a lot of sins in the contingency fund. And if you're planning to run an election campaign immediately after the budget, I think you need some goodies to give away, unfortunately, and that's where it'll all be hidden.
Right. So that'll be some extra paperwork on your dining room table, no doubt.
The dining room table is already a big mess. The other things I'll be looking at are what's going on with mental health and what's going on with Indigenous affairs.
Yeah.
Look, these are both really complicated issues because they don't totally belong in the health portfolio. They have so much else that needs to feed into them. With mental health, we were promised all these reforms, but to date everything's just sort of been handed over to the PHNs along with a whole lot of other responsibilities. And you can't do that if you're really engaged in large-scale, meaningful reform. You can't just look at it once and walk away. It needs a lot of help and a lot of shaping, and that isn't really happening. And as for the Indigenous portfolio, I mean, it's just endlessly depressing. I wasn't necessarily against the move to put it in PM&C because I think theoretically at least that means that you get a whole of government approach. But to date, all they did was move the programs and turn the funding into contestability funding on a yearly basis, all of which undermines continuity. So everything's been disrupted, and really none of the improvements that we would be looking for to make a difference in closing the gap have eventuated.
So it sounds to me like you must think there's plenty of scope in the upcoming election campaign to bring forward some really innovative policies in a cross-section of portfolios really that will improve health. Do you think we're going to see any meaningful policies being coming up?
Rumour has it that Labor is working on some policies. I'm hopeful that Labor will do something to restore what was cut by the Abbott government for preventive health. Because it is just really clear that when it comes to things like obesity and then diabetes, we are just not doing enough, and we need to make those sorts of investments. Some of the things that could potentially be done don't actually require a lot of money. They actually require thinking about things differently. So I'd like to see a health in all policies approach.
Yeah.
Obviously that makes real sense for Indigenous health, again for mental health, sometimes for aged care, for keeping people healthy in the community instead of getting to hospital. You don't just need prescription pads and doctor's visits. You need transportation and healthy nutrition and healthy, housing and all of those sorts of things. So taking a whole of government approach where the education portfolio thought about the health consequences of some of their initiatives, the transportation portfolio thought about the health consequences, could really make a difference without having to spend a lot of money. You just have to use your brain. That might be harder than spending money.
So Lesley, maybe you shouldn't pack away your dining room table after the budget, because it sounds like a health in all policies analysis as the policies come out during the election campaign might be something really useful.
Yes, look, there are a lot of people who see this as something that should really is really increasingly important. A lot of people who are smarter at it than me. But yes, that would be a really interesting way to go, wouldn't it?
Yeah, that really would.
Yes.
Well, all right, I think we should get back to our walk, don't you?
Yes, we're trying to keep ourselves fit and healthy.
Yeah, and sane.
And we're both in training for some big walks.
Yep.
You're off to Japan. I'm off to France.
Yes.
And Melissa has promised us a spot to write it all up on Croaky Blog.
That's right.
Stay tuned.
Yeah, that's right. Okay. Thanks for listening. Bye.